And there's been a lot of analysis done over the last few days and to try and work out what this means, and now to try and work out, for example, what does it mean in terms of vaccines and so on. So, I mean, this is a continual picture. And in terms of other countries involved, I mean, there are some countries that have had things that look quite similar to this but maybe unrelated. And then there are others which may well have something similar. But again, they're now looking at this properly. This has been loaded up. There's an international database of all the variants. The UK is one of the biggest contributors of that, in fact, by some distance. And so other countries will now be looking at this, other nations, to see what they've actually, where it has spread to, if it has spread elsewhere, or indeed whether it's been spreading there even before the UK. We don't know that one way or the other. And in terms of the symptoms symptoms things, so far, there is no evidence that the symptoms are any worse or different from other variants of this coronavirus. And there are many variants. And I think it's not just there's one coronavirus and this is the variant. There are many variants. It just happens that this one has quite a few more mutations than some of the other variants. So that's the reason why we've taken it more, particularly seriously. But there's nothing to suggest that the symptoms are different, that the testing is different, or that the clinical outcome is different for this variant. The main reason we are raising it to people's attention is the question about, is this spreading more quickly? And that may be cause and effect, or it may not. I think what everybody in A&Es are saying and writing is this is going up in very many parts of the country, not absolutely everywhere, but very many parts, particularly now in the southern parts of the country. And we absolutely must get on top of this, because if we do not, the period after Christmas, the most difficult period for the NHS, which is January and February in every year, is going to be extremely difficult for every area of A&E, of general practice, and the rest of the health system, and that's going to have a big impact. In terms of the impact of Christmas, the thing which we have repeatedly said to everybody, and I think it is, in a sense, common sense to everybody, is that the fact that some relaxations have been made not to the cheering, but to people's ability to meet their families over Christmas, does not mean that they should go to the top of the license of that. They should do everything that is possible. The point of this is for, under certain circumstances, families who wish to get together. But they really have to be very, very careful, and in particular, incredibly careful if they're around people who are vulnerable.
We are aware of this genetic variant, I think reported in about 1,000 individuals in England, and the authorities in the UK and under Matt Hancock's leadership obviously are looking at the significance of this. We've seen many variants, as we've always said here. This virus evolves and changes over time, and we've seen different variants emerge. The question is, what is their significance in public health terms? And certainly looking at this particular variant seems to have become more prevalent in the UK. We'll obviously need to work with our international lab network to see if that variant is becoming more prevalent on an international basis. But again, to say that this kind of evolution or mutations like this are actually quite common. The question, as we've had most recently with the mink variants in Denmark and the previous variations in the virus, does this make the virus more serious? Does it allow the virus to transmit more easily? Does it in any way interfere with diagnostics? Would it in any way interfere with vaccine effectiveness? These are questions. None of these questions have been addressed yet, and we have no information to suggest that any of that is the case. Sure, the UK authorities are doing the responsible thing, as they are, in really looking at this, in informing and putting this up on public websites. I think, like you said, they've already uploaded the sequences for everybody else to look at. It is the height of transparency. It is state of the art in the way in which national authorities communicate with other national authorities and with WHO. It shows absolute transparency, and we have every confidence in the UK scientific capacity to understand this variant and to work with us and experts around the world to do the same.